Again, thank you to Mayor Dickens' office for helping us do that. Will, so excited to see you. We've done this a lot.
Yeah, it's great to be here. Thank you again for having me.
Thank you so much. So I'm hoping that you can start by sharing with the audience some context for our summit today and what really went into the development of the national strategy on hunger, nutrition, and health, and why has this been such a big priority for the administration?
Yeah, thank you, Danny. First of all, I just want to take a step back and say thank you again to both Spelman College and to Emory University and for setting an excellent scene here. I think you laid out really a lot of the priorities that we've been talking through since the beginning of this administration, how both your universities, institutions have really been leading in this work. So thank you for hosting this. Danny, thank you. And to the food tank team for again bringing such an excellent group of folks together who are really passionate about these issues that we've really been working on since the beginning of this administration, right. In part because of the real passion around these issues of ending hunger, of improving nutrition and physical activity in this country, and especially around reducing and closing the disparities that we know exist in our communities across the country as well. So, the president hosted the first White House conference on hunger, nutrition, and health in over 50 years in September of 2022. And in the lead up to that conference, which again was really in response to a call to action by many stakeholders across this country, and really was taken up by President Biden to ensure that since it's been 50 years since we've really right. come together as a country to really examine how we go about ending hunger and reducing diet-related disease. We started by really listening and learning from many of the stakeholders who made that call to action, many of the partners that have been working in communities across the country for years and years to help us meet that goal. And so we really started with, again, hundreds of public listening sessions that we really examined these issues with partners across the country, looked at some of these issues regionally, talked to folks across sectors, across civil society, whether that was the private sector, whether it was farmers and ranchers, and the farm workers who help to produce our food and grow our food, whether that was academia and the important role that research institutions play in examining these issues. We had really, really important and critical conversations with individuals who have lived expertise with hunger and diet-related disease to both hear from them about what's working and most importantly really what's not right. working. And so through that process, my colleagues from the Domestic Policy Council, later on you'll hear from my colleague Kellyanne Blazek, who serves as Special Assistant to the President for Rural and Agriculture Policy. They took all those findings, all those conversations, and laid out a national strategy on hunger, nutrition, and health that the president announced at that conference in September of 2022 that were really the federal tools and resources that can be utilized and leveraged to help achieve President Biden's goal of ending hunger and reducing diet-related disease by improving nutrition and physical activity while closing those disparities that exist in our communities by the year 2030. And so through that national strategy, we examined these issues through 5 pillars. I know the provost from Spelman laid out some of those connections with the work, incredible work that Spelman does in the food space. But those pillars included improving food access and affordability, integrating nutrition and health, empowering all consumers to have access to healthy food choices, supporting physical activity for all, and enhancing nutrition and food security research. And we both used those as the pillars for that national strategy, for those federal tools and resources that were outlined in the national strategy, but also as a call to action for all sectors, all of civil society to lean in where they can to help us achieve these goals, because we know that the federal government cannot achieve the president's ambitious goal of ending hunger and reducing diet-related disease alone. It's really going to take all sectors of society to help us achieve that goal.
Yeah, it is an ambitious goal, but what I like about what you and the administration have done is that this is doable. We can do this, and these pillars really help explain that. And I think, the listening sessions have led to so many partnerships and collaborations, and that has been so key to this work. And I'm wondering if you can share with the audience how you connect the different organizations that you're working with one another, how you encourage that collaboration to continue.
Yeah, absolutely. Well, first of all, we're very excited to be here in Atlanta. One of our critical partners in this work was the CDC Foundation, which is based here in Atlanta. And I know you'll hear from Rachel Forensic later from the CDC Foundation, who's been a really incredible partner as we, as I mentioned, when we put out the national strategy at the conference, we also announced over 60 commitments from external partners, from state and local governments, academic institutions, community-based organizations, from the private sector, so food and healthcare companies that were aligned with the national strategy and with those 5 pillars that I mentioned earlier. That was through a partnership with the CDC Foundation and really through the conversations that we had in the lead up to the conference. And so it was really incredible to see all of that happen in such a short amount of time.
Right.
I think we really, we put those about 60 commitments together in really about 3 to 4 months from the time that the president announced that the conference was taking place to the time that we hosted that conference in September of 2022. And following the conference, we heard from so many different partners that we had connected with in the lead up to the conference, folks that reached out after the conference who were really interested in the work that we were doing. And there were several folks who said, hey, if we had more time,
right,
we would love to be a part of this work. And so the White House announced the White House Challenge to End Hunger and Build Healthy Communities a little over a year ago, as really a second call to action, again, for state and local governments, for the private sector, for organizations that are really critical to this work, on top of the progress that we're making in implementing that national strategy on hunger, nutrition, and health. And just over about a month and a half ago, we announced an additional 141 new commitments, again, from a range of organizations, totaling about $1.7 billion in financial value. Just to name a few of those important partnerships, one was a partnership between all of the major sports leagues, so National Football League, National Basketball Association, Major League Baseball, WNBA, National Women's Soccer League, and their players' unions. So it's important to have the players' voice as a part of this, with the President's Council on Sports, Fitness, and Nutrition, to both continue to build off the work they do with youth to promote fitness and physical activity, but just as importantly, to provide a nutrition education component to the work that they do with youth, to ensure that youth understand the importance of healthy, nutritious diet. So that was incredibly exciting partnership that the second gentleman announced just a couple of months ago. But we got really a range of commitments. Just to name a few from right here in Georgia, Healthy Savannah and the city of Savannah, Georgia, committed to advancing nutrition security by supporting 3 main areas of focus. One was solving communities' top food system priorities. The second was adopting policies related to equitable food access and a robust and resilient food system. And the third was around collaborating to improve healthy food access and address upstream barriers to nutrition security, improve social determinants of health, and to ensure health equity. Another commitment we received was from the Medical College of Georgia at Augusta University. They made a 10-year, $25 million in-kind commitment to launch a national training and research collaborative to serve as an open source web-based platform that will provide healthcare professionals evidence-based tools that help integrate nutrition, exercise, and sustainable behavior change. And then another one from a small town of Douglasville, Georgia, just west of Atlanta, partnership with Share Our Strength to both, they committed to launching a task force and to creating an action plan to help their community bring community leaders together, members of the community together, to both put that task force together, create that action plan to end hunger and reduce diet-related disease in their own community by 2030, similar to what we did as an administration with the National Strategy on Hunger, Nutrition, and Health. So really incredible to see such a diverse range of partners come together to work on this. And again, want to shout out the CDC Foundation for their incredible work in helping us to secure these commitments and the work that they're doing with these commitment makers to ensure that we continue to track the incredible progress that they're making.
For sure. And one of the things that I really love, that there's been so much amazing progress since 2022. And there have been these different kinds of collaborations, some that would be expected, some that would not be expected, some unusual and uncommon collaborations. I wonder if you can talk a little bit about how government agencies who never worked really with one another came together on this national strategy as well.
Yeah, well, first of all, it's been, as I mentioned earlier, it's really been incredible to see the progress just in the last year and a half in implementing the national strategy on hunger, nutrition, health. We obviously have so much work to do in this space, and I don't want to steal. I know we have a couple colleagues here from the administration, including Kellyanne and Dr. Cotright from USDA, so I don't want to steal anyone's thunder here. So I'll just go through a few of those updates, and we'll leave some of that for some of the panelists to come. But just to go through a few of the accomplishments and the progress thus far. Since the conference in September of 2022, the Department of Agriculture has invested nearly $30 million in American Rescue Plan funding in 264 school districts to update technology and facilities in their cafeterias and to help improve the nutritional quality of their meals. USDA finalized a rule that gives an estimated 3,000 more school districts in high-need areas the option to make healthy school meals available to all students at no cost to their families during the school year. The Food and Drug Administration has conducted a study to inform a proposed rule that would standardize front-of-package labeling, which, of course, provides consumers with the knowledge they need to help make healthy nutrition choices. HHS has released the U.S. playbook to address social determinants of health, which includes a set of framework of actions that federal agencies will undertake to address unmet social needs like the impact of housing and education on hunger and diet-related disease for all communities. HHS has also released guidance for states on what health-related social needs, services, and supports are allowable under Medicaid and the CHIP program. They also have approved new groundbreaking Medicaid Section 1115 demonstration initiatives in Massachusetts, New York, New Jersey, Oregon, and Washington State that allow for test coverage of services such as evidence-based nutritional assistance, medically tailored meals, other health-related social needs for individuals with Medicaid. I know my colleague from USDA will elaborate on this, but the president has also advocated for full funding of the supplemental nutrition program for women, infants, and children, the WIC program. We were at risk of not being able to meet all eligible individuals. Unfortunately, Congress, in the most recent spending bill, allocated that funding after the president and the administration advocated for that. The president has included additional funding for the WIC program in his fiscal year 2025 budget, which is really critical in ensuring that we continue to meet the need there. They also have recently released a rule that updates the WIC food package to more align with the dietary guidelines, ensuring that those families have access to healthy, nutritious food. And then I also wanted to mention the incredible work that the USDA has done in implementing the summer EBT program, which is a program that will help families, eligible families who typically would receive assistance for school meals, to be able to have additional funding for groceries during the summer months when their children are at home. And through USDA's incredible work with the states, with tribal nations and territories, 37 states, all 5 U.S. territories and 3 tribal nations have submitted plans and are implementing this new program that will begin in summer of 2024, which will is expected to serve 21 million kids this summer, which
Incredible.
is huge.
Huge.
And really historic. I do want to mention that, of course, this is a program that all 50 states are eligible for, and so there's still 13 states that did not take this opportunity. Georgia actually is one of those states that has not submitted a plan, and so I know USDA will continue to work with those states that did not take it up for this year. This is a program that states are eligible to apply for 2025, and we hope and look forward to working with Georgia and other states to do that. I believe the number in Georgia is about 1.1 million kids, children who could be benefited if Georgia were to take on this federal funding. And so we look forward to working with partners here to continue to lift up the importance of that program.
Yeah, and Will won't say this, but I can write your Congress members and encourage them to be part of that program. It's so important to make sure that those 1.1 million students in the state of Georgia get the access to the good food, delicious food, and nutrition that they need. Well, I kind of want to end on what you're most excited for. You have a lot of meetings today. You'll be hearing from a lot of people. What most excites you about today's event?
Yeah, first of all, events like this have been so helpful in securing the commitments that we talked about. We look forward to continuing to do this work with so many partners. We look forward to learning today. We learned so much through these events from the local leaders who are doing so much incredible work on the ground. And can really help inform some of the policies and programs that we're working to implement. And as you just touched on, there's so much happening in this space and so many opportunities that states and communities can take advantage of. And so both looking at opportunities for us to connect the dots between those resources. Yeah. And then for us to just be able to learn more about some of the approaches that all of you are taking in your communities, and find ways for us to better support the work that you are all doing. So thank you again for being here, and really excited to be here throughout the day to listen to these conversations and have conversations here, network on the side of those conversations to learn more about all that you're doing and talk about how we can be helpful.
Thank you so much. Well, I do want to say it's been such an honor to work with Will and Kellyanne and so many other people in the White House. It makes me emotional because they are truly passionate about this work and they are true public servants, as I said before. So please give Will a round of applause. Thank you.